Thank you for joining us for this brief 10-minute webinar about opportunities for state participation in the National Survey of Early Care and Education that we will refer to as the NSECE. The purpose of this webinar is to provide state administrators and early childhood leaders, policymakers, researchers, and related funders and sponsors with initial information about opportunities to participate in the National Survey of Early Care and Education planned for the year 2024. This way, they can consider whether to explore these opportunities further with support from the NSECE project team. Opportunities for state participation build upon the national NSECE infrastructure and give states a unique opportunity to gain access to rich data about their childcare and early education systems. This creates opportunities that are often not otherwise available, feasible, or affordable for individual states. The National Survey of Early Care and Education is a nationally representative study that documents the use and availability of childcare and early education across the U.S. The NSECE is funded by the Office of Planning, Research, and Evaluation in the Administration for Children and Families in the United States Department of Health and Human Services. The survey is designed to gather national estimates related to U.S. early care and education to inform key national policy and research priorities. The NSECE was conducted in 2012 and 2019 and is currently planned again for 2024, pending full review and approval by the Federal Office of Management and Budget. Past NSECEs have included a set of 4 integrated surveys: a survey of households with children under 13, of home-based providers, center-based programs, including centers providing early care and education to children not yet in kindergarten, and center-based classroom-assigned staff. A similar approach is planned for 2024. What NSECE activities will happen in each state? The NSECE planned for 2024 will include data collection activities in all 50 states and in the District of Columbia. Once OMB approval is granted, the sample will be drawn within each state, including individual center-based and listed home-based providers. In addition, public and private elementary schools may be sampled and screened for the presence of childcare and early education programs located in schools. The NSECE project team may be contacting childcare, resource, and referral agencies or other stakeholder groups to request endorsements for the study. During this process, none of the sample information will be revealed, only information about the study design, timeline, and goals. What could the 2024 NSECE mean for states? A key advantage of the NSECE is that all 50 states and DC are included in the sample. This means states may compare themselves with other states, such as states in the same region or states with similar policies, or states can compare themselves with the entire nation as a whole, using the entire nation as a benchmark for their own childcare and early education landscape. Even though the NSECE includes all states and DC, states vary in the number of cases that they contribute to the NSECE. Larger states that are home to more interviews have more statistical capacity to produce estimates at the state level. Mid-sized and smaller states that are home to fewer interviews may not be able to produce state-level estimates, although their data are used to produce overall national estimates. The fact that the NSECE is able to support state-level estimates only in some states is driven by statistical considerations and the fact that we have to protect the identities of providers and people who participate in our interviews. How have the 2012 and 2019 NSECE state-level data been used? Here are some examples of the types of compelling analyses that states can do by using NSECE state-level data. Analyses can be conducted at the state level related to parent work schedules in households with young children, center-based provider characteristics, home-based provider characteristics, and workforce characteristics and working conditions. There are topical areas that states often lack data on, especially if they fall outside of analyses that can be informed by administrative data sources. For example, household topics like parental work schedules. In 2012, there were state supplements collected in Illinois and New York, and in 2019 in Minnesota. Each state had within-state disparities that they had observed in their program administration and other data that they wanted to understand further. For example, what are the challenges recruiting more rural families into the subsidy system? What are the different experiences of low-income suburban families and workforce compared to low-income families and workforce in urban areas? How do different parts of the state vary in the characteristics of their providers and their workforce members? What state supplement options are available? As was just described, the national study as it is designed is relevant to states in a variety of ways, but there is no guarantee that the available sample for a state will align well with that state's priorities. Recognizing that, OPRE, as sponsor of the national survey, has arranged for states to be able to supplement some of the national study activities with state or local funds. As you can imagine, the study will have a lot of data collection operations, sampling methods, and analytic tools that may be harder to come by for any one individual state. There are 3 ways that states may want to supplement national study activities in order to gather data that more directly speaks to the state's own information priorities. One of these is to commission additional interviews to be conducted in the state. A second is related to the sampling frame construction process. This is the process that we use to create a list of possible survey respondents from the different types of childcare and early education providers across both center-based and home-based settings. The third supplement opportunity has to do with analyses that would link state administrative data, which is often confidential, to the survey data in order to conduct a variety of early childhood policy-related analyses that wouldn't otherwise be possible with only administrative data or only survey data. I will now very briefly provide a few more details about the state data collection supplements. Adding additional sample is a way to expand what's possible for state-level analyses beyond what's possible using just the national study sample for a given state. The state could sponsor additional data collection that would increase the number of interviews that would be conducted and expand their ability to analyze childcare and early education data from their state. There are so many variables in how this works that we would encourage states to reach out to us to see if they may be interested in sponsoring some additional data collection. To start that conversation, a state would provide the types of information listed here, including populations of interest, analyses of interest, priorities, and so on. The NSECE project team would then provide specifications and ideas about the state supplement and the related budget estimates. The NSECE project team is here to help states explore the potential of these opportunities with as little burden as possible on the state. Once agreed upon, the supplemental sample would then be fielded at the same time as the national sample and be part of all data preparation and analyses tasks. Final supplement data will be part of the national study files and would be accessed the way that the rest of the data are accessed. Another option would be for states to ask the NSECE team to develop a list of childcare and early education providers in the state. Having a rich, geographically detailed data file that includes a variety of population and provider information can be a valuable data resource for states. The NSECE project team could produce a special analysis file from the list building process that we use for the national survey. This would be an extension of the process of building the sampling lists and sampling frame that is conducted as part of the NSECE. A third option is that states could request that the NSECE team conduct analyses linking NSECE survey data to states' childcare subsidy data as a secondary data analysis. The NSECE team would be able to provide the appropriate analytic expertise and a secure computing environment for the work, as well as highly restricted linkages to the survey data. Now about the timeline for state supplements. While the survey will not be conducted until 2024, preparations are already currently underway. Discussions regarding the supplement options for list building and for data collection will need to occur in the early fall of 2022 in order for design to be finalized and executed in time for inclusion in the 2024 NSECE data collection. Our timeline is as follows. During the early months of 2022, we will be working with states and interested groups to explore and finalize decisions about state participation in the 2024 NSECE. Final commitments about supplements and provider list enhancements are required by the end of this calendar year in December 2022. Linkages to subsidy data can be arranged in future years. Then, during 2023, the NSECE team will be building the sampling lists and sampling frame, finalizing the surveys, and doing all of the required work to prepare for fielding the NSECE in 2024. In 2024, the survey will be conducted and data files will be available in late 2025. To meet these timelines, we encourage you to reach out to the NSECE team as soon as possible. You can reach out by contacting the NSECE project team via email at nsece24@norc.org. You can learn more about the NSECE on the Administration for Children and Families website. You can also reach out to the federal project officers on the NSECE, Ivelisse Martinez-Beck and Ann Rivera. We thank you for your time and your interest, and thank you for supporting the National Survey of Early Care and Education.